Today I'm going to share with you 4 tips to reduce cholesterol without needing medication. Come with me. Number 1. Diet. Diet is a fundamental aspect of health, and understanding how it influences cholesterol in our body is essential. Let's delve deeper into this topic. First, it's important to understand what cholesterol is. Cholesterol is a fatty substance, more specifically a lipoprotein, that circulates in our blood. It's a key element for various vital functions. So, why is it so important? Cholesterol plays a crucial role in the formation of bile salts, essential for the digestion of fats, in the synthesis of vitamin D, in the structure of cell membranes, and in the production of sex hormones. Therefore, it's not correct to consider all cholesterol as harmful to the body. There are different types of cholesterol, commonly classified as good and bad. LDL, low-density lipoprotein, is often referred to as bad cholesterol, as high levels can lead to plaque buildup in the arteries, increasing the risk of cardiovascular diseases. On the other hand, HDL, high-density lipoprotein, is known as good cholesterol, as it helps to remove bad cholesterol from the body, transporting it back to the liver, where it is processed and eliminated. Besides LDL, VLDL, very low-density lipoprotein, is also considered potentially harmful. It's atherogenic, meaning it contributes to the formation of fatty plaques in the arteries, raising the risk of problems like heart attacks and strokes. Therefore, it's essential to know how to control cholesterol levels through diet. A balanced diet can have a significant impact on reducing cholesterol. Increasing fiber intake is an effective measure. Fiber-rich foods, such as vegetables, fruits, nuts, oatmeal, legumes, and whole grains, help reduce cholesterol absorption in the intestine, besides promoting healthy digestion. Including these foods in your daily diet can significantly improve your lipid profile. Another important aspect of the diet is reducing the consumption of animal fats. Red meats, full-fat dairy, butter, and other products rich in saturated fats and cholesterol should be consumed in moderation. A good practice is to replace these fat sources with healthier alternatives, such as lean meats, low-fat dairy products, and primarily plant-based protein sources. Additionally, the method of preparing food is also crucial. Cooking in a healthy manner, avoiding frying, and preferring methods like steaming, grilling, and baking can significantly reduce the intake of harmful fats. Choosing healthy oils like olive oil instead of saturated fats is also recommended. Number 2. Physical activity. This point is one of the most important. Physical activity is beneficial for 100% of people and 100% of diseases, whether they are cardiac, gynecological, etc. Exercise helps in weight control, in the digestion and metabolism of food and nutrients, and plays a vital role in reducing cholesterol. It's common to observe patients with high bad cholesterol who, by improving their lifestyle and incorporating physical activity, manage to reduce these levels. The question of which physical activity to practice is important. A combination of aerobic exercises like running, swimming, or cycling with strength training activities like weightlifting is ideal. This mix not only helps reduce LDL, bad cholesterol, and triglycerides, but also increases HDL, good cholesterol. Therefore, for those with cholesterol issues, physical activity is indispensable. You can't just take medication without doing physical activity. That's wrong. You're merely covering up the problem without effectively addressing the condition. Regarding the ideal amount of weekly physical activity, it's recommended to do between 150 to 300 minutes of moderate activity or 75 to 150 minutes of intense activity. These aerobic activities should be complemented with at least 2 weekly sessions focused on gaining muscle mass. This combination is essential for a comprehensive and effective treatment of cholesterol. Number 3. Avoiding excessive alcohol consumption. Excessive alcohol consumption is a significant factor in weight control and metabolic health. Alcoholic beverages, when consumed in large quantities, can increase blood sugar levels and elevate triglycerides, a type of fat found in the blood. Many patients have high triglyceride levels due to excessive alcohol consumption. This is a crucial aspect to consider. There are cases where patients show elevation only in triglycerides. In these cases, strict diet control and reducing alcohol consumption can result in a significant decrease in these levels. Besides the metabolic impacts, excessive alcohol consumption also negatively affects daily life. It can impair productivity, decrease motivation for physical exercise, and compromise overall performance in various activities. Therefore, moderation in alcohol consumption is essential not just for maintaining weight and metabolic health, but also for overall well-being and quality of life. Number 4. Losing weight. But why weight loss? Weight loss is a crucial aspect in controlling cholesterol and preventing cardiovascular diseases. Even a small weight reduction can bring significant benefits to the cholesterol profile. This is evidenced by studies and observed in clinical practice. Patients who adopt a healthier lifestyle, including regular physical activity and a proper diet, not only enjoy the direct benefits of these practices, but also tend to lose weight. This weight loss contributes to the reduction of visceral fat, a type of fat stored in the abdominal region and associated with an increased risk of cardiovascular diseases due to its ability to promote inflammation in the body. Weight reduction positively influences the lipid profile, that is, decreases LDL, bad cholesterol, and increases HDL, good cholesterol, as well as reducing triglycerides. This, in turn, lowers the risk of complications like strokes and heart attacks. For patients with altered cholesterol, weight loss is therefore essential. And it's worth noting that all these recommendations form a set of beneficial measures for those with cholesterol problems. Regarding the need for medication, this depends on various factors and is not based solely on elevated cholesterol levels. There are patients who benefit from the use of statins, which are cholesterol-controlling medications, while others do not need them. The treatment should be personalized and carefully evaluated by a health professional. But it's important to stress again, just taking medication is wrong. You won't be addressing the root of the problem, which are your habits. Effective treatment for cholesterol includes these 4 topics covered in the video. I'll do a quick review for you. 1. Diet. To control cholesterol, it's essential to increase fiber intake and reduce animal fats, including more vegetables, nuts, oatmeal, and legumes in your diet, and decreasing the consumption of meats and dairy products will significantly help in controlling cholesterol. 2. Physical activity. Physical activity is crucial for reducing LDL, bad cholesterol, and triglycerides and increasing HDL, good cholesterol. A balance between aerobic exercises and strength training, like running and weightlifting, is ideal, with a recommendation of 150 to 300 minutes of moderate activity and 75 to 150 minutes of intense activity per week. 3. Avoid excessive alcohol consumption. Excessive alcohol consumption can raise triglyceride and blood sugar levels, impairing cholesterol control. Moreover, alcohol can negatively impact productivity and motivation for physical exercise. 4. Weight loss. Even a small weight loss can bring significant benefits in cholesterol control. Physical activities and a proper diet contribute to reducing visceral fat, lowering LDL, increasing HDL, and reducing the risk of cardiovascular diseases. These lifestyle changes not only lower cholesterol, but also strengthen your overall health and well-being. Start today and see the difference in your life. Thanks for watching. Don't forget to subscribe to the channel. See you in the next video.